But I wanted to ask you, Mike, about COVID, no? Because it's
Mm-mm.
related to this discussion then of
Mm-mm.
social media and then what influences people's thoughts about it, no? Help
Yeah.
us understand. Sa mga rankings kasi sa mundo,
Mm-mm.
kulela tayo pagdating sa handling ng COVID pandemic on a
Mm-mm.
range of indexes, no? Sa latest
Mm-mm.
Nikkei Recovery Index, for
Yeah.
example, last
Mm-mm.
tayo sa 121 countries
Mm-mm.
pagdating sa
Mm-mm.
infection control,
Mm-mm.
vaccination at mobility.
Yeah.
No, pagdating yung mobility, ibig sabihin yun, yung it's related
Transportation.
to all these
Mm-mm.
quarantines and
Mm-mm.
lockdowns and
Yeah.
yung pagbubukas ng economy and all that.
Mm-mm.
And then hanggang ngayon, tayo na lang ang bansa na hindi pa nagbubukas ng in-person classes, although now there's a
Mm-mm.
timetable, but ang dami,
Mm-mm.
almost all the countries in the world now have in-person classes, with
Mm-mm.
various safety protocols. Tayo
Mm-mm.
parang wala
Yeah.
pa tayong lakas loob, no, para gawin
Mm-mm.
ito. Obviously,
Mm-mm.
that's also a reflection of the management of the pandemic. No? So
Mm-mm.
my question, Mike, is how much of this problem, this
Mm-mm.
apparent inability to handle
Mm-mm.
probably the biggest crisis of our time, is
Mm-mm.
due to cultural issues?
That's what it's often projected as, no, na, especially because we have a military controlled task force, no, and it's very convenient to keep saying tigas ng ulo ng Filipino, pasaway, and all of this, despite the statistics showing that we are very conforming. I mean, I always tell people, ang totoong pasaway, mga Kano. They refuse to wear their mask. They refuse to get their vaccines. Governments used to send their scholars to us, no, to take public health and engineering and all of that, no? Because we had an advanced public health system up to the 1950s. We were producing vaccines. No? We produce our own BCG for TB. We produce our own rabies. No? We were a model. No? And then hinayaan, no, the public health system, which wasn't that strong, but hinayaan na. We allowed ourselves we followed the US model, which was mainly the private sector. No? We did not have a national health service like Britain did. You'll see that the Commonwealth countries like India and Malaysia also set up a public healthcare system. No? Look at India; they're producing their own vaccines. Of course, they had problems with their crazy prime minister as well, no? But they've recovered pretty much. No? So we are now in a situation where we are totally dependent on the outside world for not just for the vaccines, but for medicines. No? And our information system is very weak because we never really built it up. No? In fairness, I'd say the early years after 86, no, under Dr. Begson and his very helpful executive assistant at that time, Dr. Flavier, no, medyo no, there were efforts really to do public education campaigns, and then it lagged off. The health department has been very bad with communications. No? I know they have a good team right now, but their hands are tied. Kaya yung messaging ang hirap. There's lack of consistency. Look at the shields thing. We're the only country in the world, until today, incidentally, it's now optional, but we insisted on the shields. No? Every time I run into friends from China, no, I always tell them, why aren't you using a shield? We don't believe in shields. I said, I know, that's a trick question because these shields are made in China. You are not required to wear shields in China. So why are you dumping it on us? And they laugh and they said, you know the answer. It's corruption again, right? Think of the millions of pesos spent for those shields,
Pero
which
sabi ni
no
Dr.
other
Salvana, science-based daw yung
It's not
shields
science-based.
mandate.
Oh God, no. And look, now they're withdrawing it. No? They put up the plastic dividers. They emphasized the wrong things. No? So they put up the plastic dividers in jeepneys and they said hindi na kailangan. But DepEd is requiring all their teachers to put up these dividers naman in the schools that are going to have face-to-face. Nakakahawa talagang
So
mga
we're
bata.
emphasizing the wrong things. So what should we be
Yes,
emphasizing? What are the right things to emphasize?
we should be emphasizing, if we had a good public health care system, we should be empowering the health workers to mobilize people, to reassure them. No? Ang tingin ng mga tao sa healthcare workers is parang assistant ng mga police to look for people who have who are infected and to put them into quarantine. People are hiding their family members with who are infected. They should be teaching us. WHO is talking a lot now about self-care. So I'll give you another example. These rapid antigen tests. In Britain, you can call and get your free test. It's sent to you, so you can test your own family. Dito, binabawal pa rin nila. Although, of course, it's sold all over Shopee and at outrageous prices. It's now down to 90 pesos per test, if you buy it from. But it's a matter of teaching people how to use. I use it at home, and both my drivers tested positive. I said, wow, if I didn't have these tests here, I would be dead now. I would have been infected, and I'm old and I have comorbidities. Pero lahat na ito would be part of the public healthcare system. I was talking about the National Health Service of Britain, where they actually are encouraging home testing. So we're we emphasize the wrong things.
Hi, I'm Howie Severino. Check out the Howie Severino Podcast, an original for GMA News and Public Affairs. New episodes will stream every Thursday. Listen for free on Spotify, Apple Podcasts, Google Podcasts, and other platforms.